At the end of the mastectomy procedure, the surgeon places a drain in the surgical area. It is held in place by a simple stitch where it exits the body. The drain is composed of tubing and then a collection bulb. The bulb has a nice little tab on it that connects to the loop on the surgical bra to hold it securely in place. The purpose of the drain is to collect blood and fluid that builds up in the surgical area, and this aids in wound healing. And the drain works by simple suction. By compressing the bulb and capping the top, we're creating suction that's continually drawing the blood and fluid from the surgical area. Your job is drain care. So after surgery, you will need to empty this drain a minimum of 3 times a day. So we'll want you to prepare your supplies, gloves, measuring cup, your drain output record, and a pen. So you want to put your gloves on, bring your measuring cup over to the center. You're going to remove the collection bulb from its tab. Open the top here. Just simply snip that open. Squeeze it completely so all of the fluid in the bulb is in the collection cup. Turn it completely upside down and compress the bulb completely. Cap your top. So again, the collection bulb is going to look like this. You have full suction and it will continue to drain. Then we're going to return the bulb to our holder. And the drain is now secure. At this time, we'll turn our attention to the drain output record. You can see in this measuring cup, we have 20, 40, 60, 80 milliliters. The amount of fluid removed is measured in milliliters. It's a little difficult to see when there's nothing in it, but as you can see here, we've got 60 milliliters of fluid that have been removed. So on our drain output record, we're going to place the date, the time of day that the drain was emptied, and the amount. So for today at 3 p.m., we have 30 milliliters. Again, you will empty the drain 3 times a day. First thing in the morning, mid-afternoon, 2 or 3 p.m., and then again before bed is typically good timing. But if this bulb is full and looks like this, in between the time you're emptying, we want you to empty it an extra time. And then you're totaling the output for the day, and you will have a drain output record, so every single day you're recording your drainage. Once you've recorded, we want you to take your measuring cup and you flush the drainage, and then you can remove and discard your gloves. The drain itself, both the tubing and the bulb, do not require any care. We don't want you to wash them at all. Your only job after surgery is to empty the fluid in the drain so we get this continual light suction to remove the fluid from the surgical area to aid in wound healing. The drain remains in place for at least a week, and it may stay in place longer depending upon the amount of drainage. When the drainage begins to decline, and there's really a very small amount in there, you can change your measuring cup to this small 30 milliliter measuring cup. because typically the drain is removed when you have 30 milliliters of drainage for the entire day for 2 days in a row. And if you have had a bilateral mastectomy and have drains on both sides, sometimes one drain is removed prior to the other, thereby the importance of the drain output record. And then each time that you empty the drain, you are compressing the bulb and continuing suction again, even when there's a very small amount. Some patients feel as though they look at it and say, well, there's so little, I don't really need to empty. Regardless of the amount that's in there, we still want you to empty it and record it 3 times a day. Typically, the fluid that's draining starts out bloody, then goes to a darker pink, a lighter pink, and then to really a clear yellowish color. The amount of fluid tends to decrease over time, although it's very common that you have 2 days in a row with the equal amount of fluid for that day. Sometimes on Wednesday, you have a little bit more fluid than you did on Tuesday. Also, if you've had a bilateral mastectomy and have a left-sided drain and a right-sided drain, you may have unequal amounts of fluid, and that's all perfectly normal. If the drain output is low and you see a little bit of blood that is adhering or sticking to the tubing, we'd like you to do what we call milking or stripping, where you hold the tube right here, right where it exits the body, and you strip it or milk it. You move your hand and hold again and strip it all the way down into the bulb, which is removing any of that blood that's collecting and then continuing to aid in the flow. You are secure here where the tubing exits the body, but we do like you to hold it there just so there's no pressure or there's no tugging on the tube. The drain remains in place for at least a week, typically not removed until your first postoperative office visit. It may remain in longer depending upon the amount of drainage, which is why it's so important to bring your drain output record to the breast surgeon and also to the breast reconstructive surgeon if you've had reconstructive work in addition to your mastectomy. To remove the drain, the surgeon or the physician's assistant simply removes the stitch and pulls the drain out, and then a gauze pad is placed on the site. And you may have, a dribble or two of drainage for a day or two, but that site will heal nicely with nothing else that needs to be done for it. You should receive a bag of supplies with everything that you need for drain care at home. This also includes written instructions and your drain output record. I would recommend that if you are overnight in the hospital, that you empty the drains with the nurse before you're discharged to home. Just having the experience of emptying the drain with the supervision of the nurse can make being at home and emptying the drain a little bit easier. And if you have a family member or a friend that's going to help you with drain care at home, it's a good idea to have that person come to the hospital and observe you and the nurse before discharge as well. If you've had a mastectomy without reconstruction, the breast surgeon typically allows you to shower. So for showering, we have this little shower caddy that goes over your head, and then the bulb of the drain can be placed right here into the shower caddy. Now for your shower, you will be removing the bra. You can let the water just flow from your back over your shoulders. We don't want you to wash the surgical area. We don't want you to use any soap, but the water can flow over the surgical area. And when you're done with your shower, we want you to dab, dab, dab so that you're nice and dry, completely dry, before the bra goes back on again. And this surgical bra is worn 24/7 because we want that little bit of compression to aid in healing. Please call your surgeon's office if you have any questions or concerns. We are always available to you.